skies are looking busy once again despite the continued threat of COVID-19, but some airlines are putting a premium on the health of their passengers. We hear more on traveling in the new normal from CNN International's Richard Quest, joining us from New York. Richard, great to have you with us on The Final Word. The number of infections and fatalities continue to rise in the United States. What is the advice right now of the Center for Disease Control and Prevention for Americans who are planning to travel during this Thanksgiving holiday?
It's very simple. Don't. I mean, that is the advice of all the experts, but it is advice that is not being, I would say, universally or widely followed. If you look at what the TSA says, and nearly 1 million people have gone through TSA security at the US airports, and if you look at the number of people on the roads, it would suggest that although it's lower than normal, there are still a sizable number of people who are planning to go and visit friends or relatives for Thanksgiving, which is, by the way, the busiest travel season in the United States. And the fear is from the authorities that Thanksgiving will turn into a super spreader event. The number of infections number of cases is now a total 12.5 million, and we're getting daily totals of new infections around 150 to 190,000. So that gives you an idea of the severity and gravity, Rico, of the problem that they're facing. But people are traveling when the authorities say don't.
Richard, you were recently on a transatlantic passenger flight from Newark, New Jersey to London. What were the health protocols before you boarded the flight?
This was a particular flight. This was an experimental series of flights that United Airlines was doing from Newark, New York to London, where everybody on board had received a COVID test during the departure process. Only those who were negative were allowed to board the plane. There was one passenger who did test positive, and he was duly sent home. His wife came to pick him up. The rest of us got our tests, got our negative results, boarded the plane. Now, I know that people will say, well, just because you've had a test now doesn't mean you couldn't get it in 20 minutes' time or half an hour's time or whatever. But you've got to look at mitigating risk here. And the reality, Rico, is that if you have tested everybody on the plane, the chances that they will turn positive or become infectious during the 6-hour flight is quite remote. And even if they do turn positive, there was only 36 people on board the aircraft. And even then, everybody is wearing a mask and sort of distanced around the cabin. So I do believe that the future is, until vaccines become widespread, pre-departure testing in some shape or form with a test upon arrival and a short quarantine, perhaps.
But, Richard, every country have their own safety protocols.
Yep.
They have all different kinds of testings, from RT-PCR to rapid antigen testing. What kind of testing did United Airlines adopt for you to be able to get into that plane and to London?
Well, it is a rapid results, but it is a PCR version of it. So they were quite clear about that. It is a PCR test. Now, unlike, forgive me, if we get indelicate about it, unlike those where, you go all the way up and it sort of tickles your brainstem. No, excuse me, it wasn't one of those. It just went up just partially up the nostril, but I was told it is still a PCR test. I think you have to understand this patchwork quilt of rules and regulations does need to be standardized, but it won't be. The reality is every country is doing what it says, what it should. I'll give you a really good example. New York State, where I am at the moment, originally said if you come back from those countries, high-risk countries, you had to have a 14-day quarantine. Now they've changed that to a test within 72 hours before coming here and a test on day 4 after arriving. The UK is about to do something similar, where you would test before you leave, and so you get a test upon arrival, and you get a test. So you get a test 5 days after you arrive. And it's you see, even now, I'm grasping to get to the minutiae of the various testing plans. Germany changed its testing regime, as did Israel and France. You have to be up to date. It can change while you're travelling, and the long and short of it is there is no single standard.
Yes, there's no single standard like here in the Philippines. Richard, when you arrive, you have an RT-PCR test. And while you are awaiting your result for that RT-PCR test, whether it be positive or negative, you have to be quarantined in a hotel between 48 to 72 hours. And if the result comes in positive, then you'll have to be quarantined in a government facility. So it really varies and sometimes really confusing from country to country.
Oh, not sometimes, Rico. Always confusing. Always. I mean, I just did a long filming trip, which took me to Dubai, which had one set of rules, then to the Seychelles, which had another set of rules, then to Turkey, which had another set of rules. But I transited on my way back to New York through Frankfurt, in Germany, which had just got a new lockdown light. It didn't affect me, but I had to be up to date with the German rules in case I had to stay there or move on there. And then I came back to New York, which had just changed its rules. No, I mean, look, travelling internationally at the moment is not for the faint-hearted. Over a 2 to 3 week period, I must have had about 8 or 9 COVID tests, because each time we thought we'd met the rules, we either had done the test too early, or we needed another one, or we were just doing tests to have one in our back pocket. So we had a piece of paper that said, I'm COVID negative. I think what we're looking at, we got a glimpse of the future with Alan Joyce of Qantas recently. Now, Alan Joyce, CEO of Qantas, basically said they are looking to change the terms and conditions for Qantas so that passengers will be required to have a vaccination and a vaccination certificate. Now, you can't do that immediately, and it'll be till mid-next year when vaccinations really get into high gear and many people have got them. But that's the future. Somehow, somewhere, either through Travel Pass or through Common Pass or one of the other new digital storage vaults being set up, you will go to a recognised lab, have an authoritative test, which will reside in a digital vault that the airline or government can access. You will have a chain of integrity of the vaccination, its result, and its storage. And you will travel. That will be how it will go. You will have to give your details of your vaccination. That's the future. You can take this to the bank, Rico. You can take it to the bank. The future for global travel is either a test or a vaccination with the information being stored on a digitally secure, accepted site.
Well, unfortunately, that is the new normal, Richard, for the travel industry. But when you were inside that aircraft, did you feel safe? Did you feel comfortable taking off your face mask and moving around without one?
Well, you know, because you're not allowed to. You have to wear your face mask throughout the entire time on the aircraft. The airlines say that the statistics show, admittedly provided by the airlines, that flying is the safest form of travel. Because of the way in which the air comes in at the top, it's pushed down and it's sucked out the bottom. It doesn't go left to right, it goes top to bottom. Secondly, so the airlines say it's not just the HEPA filters, the hospital-grade filters, or the fact you've got the mask. It is a series of checks. The first, pre-check. Temperature, are you feeling well? Have you been in touch with somebody with COVID? Are you in COVID? Are you likely to be asymptomatic? If you pass that test, you then board the plane, distanced. they've spaced people out on the plane if it's not full. But assuming you're all sitting next to each other, you have to wear your mask. I had it here a minute ago. You have to wear your mask from the moment you get on to the moment you get off, only removing it to eat. So these are a series of hurdles, any one of which is designed to prevent the spread of virus should a passenger be infected when they get on board, should there be an infectious passenger on board. So, have there been cases? Yes. Have there been many? No. Is flying safe? Yes. Would I have any hesitation in flying? No. I will get on a plane anytime you like.
But Richard, you were only 36 passengers on that flight from Newark to London. So, is it still a good business proposition for airlines to continue what they're doing for these transatlantic flights from the U.S. To London, given the fact that you only have a handful of passengers on the plane?
No, Rico. What the evidence, and it's just the evidence of the studies that have been done so far, they show that the risk of transmission is low. Now, can you mitigate it by spreading people out across the aircraft? Yes. If it is a full flight, does your risk go up? Yes. But the way the filtration system, and bear in mind one other point here. Many people who are being extremely snotty-nosed about flying will go out to a bar. They will go and sit in a restaurant where, you know, there are far fewer safeguards. The reality is it is safe to get on board an aircraft.
But what about the airline business? I mean, only having 36 passengers with more than 170 seats, is it still a viable business option for airlines like United Airlines and other carriers to fly these transatlantic flights?
No, it's not. No, it's not. And that's why they've received huge assistance in the United States under the CARES Act. They are burning anywhere between $8 to $10 to $15 million a day. But that's a burn that is down from more than $100 million at the start of the pandemic. All the major airlines have recapitalized over the early parts and are now capitalized so that they will see through. Is it possible that an airline will go under? Yes, but the major airlines, no. They have been recapitalized. They have got deep pockets now. They will burn considerable amounts of money, which is why they want to move to a quarantine, not to get rid of quarantines rather and go to a testing regime. But no, it's not a long-term solution. But with a vaccine on the way, most of the airlines believe they can see their way through.
Richard Quest, thank you so much for joining us on The Final Word on CNN Philippines.